In Nigeria, most rural dwellers live below the poverty line, surviving on less than $1 a day. This daily hardship and extreme poverty has been worsened by the economic impact of COVID-19. This level of poverty increases the risk of mental health problems and can be both a casual factor and a consequence of mental illness. Unfortunately, people with mental and psychological disabilities in Nigeria are often societal stigmatized, physically and sexually victimized. To worsen matters, people living in these rural clusters usually have to travel very long distances to reach the nearest primary healthcare centers, which are usually geared towards maternal and childcare, and occasionally the treatment of minor physical ailments and infectious diseases. On this episode of Global Agenda, we will be speaking with the project manager of a telemedicine and mental health support for digitally underserved communities in Nigeria during the COVID-19 pandemic. I'm Olamma Tukwa, and welcome to Global Agenda.
Unprecedented measures to slow and interrupt transmission of COVID-19 are buying us time and reducing pressure on our health systems, but at a significant social and economic cost. Physical distancing and isolation measures, the closure of schools and workplaces are particularly challenges us as they affect what we love to do, where we want to be, and who we want to be with. It is absolutely natural for each of us to feel stress, anxiety, fear, and loneliness during this time. At WHO, we consider our mental health and psychological well-being as being very important consequences of COVID-19.
Mental health issues in Nigeria, it's something that has not been given adequate attention. A lot of people are going through mental health breakdown, and mental health is not just about people who have psychiatric problem. It's a socio-cultural issue where people do not want to talk about. People feel shy to talk about it, and even when people are undergoing some kind of mental breakdown, they do not want to speak about it, so they are not assumed to have some mental imbalance. And this is not a conversation that has been going on very well in Nigeria. This is a sector that has not been given the kind of attention that it deserves. So I think that people need to speak up, and then the COVID-19 pandemic, the outbreak, exacerbated the issue, and a lot of people are committing suicide. There's more of reported cases of sexual and gender-based violence. These are for cases that are reported. Imagine in the rural communities where we do not have these cases documented. So you have more people with the suicide rates are really increasing. And so it just tells us that we need to change our orientation about mental health.
Wow, thank you very much. So are there mental health disorders in Nigeria? And if they are, what is the percentage of people currently living with this disorder?
Mental health disorder exists in Nigeria. We have people living with mental health disorder. In fact, according to the World Health Organization, it says that 1 in 4 Nigerians have mental health disorder. And owing to the current economic situation, these statistics might improve, or it might be increased. So this sort of reinforces the fact that we need to guide our mental health. We need to also, propagate and sensitize people on, mental health awareness, and also change our ideology about mental health, and also find ways that we can guide our mental health as well.
Wow, quite interesting facts there, because usually this is seen as something that, foreign people try to get help for. It's not really African to speak about these issues. Now, has this pandemic contributed to this disorder in any way, and what populations are most vulnerable in this?
The outbreak of the COVID-19 pandemic has impacted greatly on global mental health generally. You find out that information and misinformation on the transmission of the virus, its incubation period, has its own impact on socioeconomic activities in Nigeria, and this has generally impacted the people's mental health in Nigeria. And then again, the measures that have been put in place to curtail the COVID-19 pandemic has also contributed in, and affected the way people have been affected, the way people has affected the mental breakdown for people. So it has like a detrimental effect on the mental health of Nigerian citizens.
It is almost 3 months, since the devastating EndSARS protests that became bloody. And by the way, the doves that were released on the Armed Forces Remembrance Day did not fly. Food for thought. So a lot of that was as a result of mental issues due to the economic situation in the country. Now, what are some ways in which these vulnerable groups can have access to support and to also have their proximity, looked into?
Okay, so we're going to be making use of digital services to provide support to these vulnerable communities who do not have support, who do not have any form of access to mental health support. According to the Nigerian Communications Commission, about 185 million plus Nigerians have subscribed to GSM networks in Nigeria. And according to the reports, in every year, there's a 7% increase on more, subscribers to this network. And telemedicine uses electronic digital services as well as telecommunication technology to provide mental health support to this vulnerable group. So we'll be making use of this GSM to bridge the gap between vulnerable people or vulnerable communities who do not have access to internet but can use text, SMS-based platforms to send text messages to people who provide the support, while they can get mental health support remotely from this, GSM. So we're using that GSM platform to bridge this gap to communities who do not have access to internet but can get support remotely.
I'd like to know, is there any way to properly find out the assessment methods to know if a person indeed has a disorder? And is there any capacity building for these communities? Take, for instance, your organization is not there to provide this support. Are there other sustainable methods in which people can still get access to quality mental health support?
Of course. Part of what we'll be doing, we'll be providing sensitization to constituents of these communities, these vulnerable communities, talking to them about mental health, providing support to people who may have who may have some mental breakdown, and just for sustainability reason and also for building the capacity of members of the community, we'll be training about 10 people from each of these clusters to provide mental health support to people, to members of their communities, wherever the help, whenever the need arises. So they do not, need to wait for the project or for experts. So we're going to be training them, building their capacity in such a way that they'll be working as first aiders and providing first aid support to mental health victims who may need mental health support.
Empowering the vulnerable residents in rural clusters across Nigeria towards a better state of mind will not only facilitate improvement of the health and socio-economic conditions of persons during the COVID-19 pandemic, but will also help to build long-term resilience. Thank you so much for staying tuned. I'm Olamma Cares, and you are watching Global Agenda.